Pain management was an interesting field for me because when I started working in the field of medicine, went through medical school, I couldn't really find a field that I could truly relate to and enjoy. And many different types of specialists exist out there. And as I started working in pain management, I started realizing that, these were a group of people that were essentially neglected. I mean, when it comes to acute pain, there are treatments today. You could get your hip replaced, your knee replaced, you could have surgeries, you could have all these different treatments. But for people who don't have outward signs of a broken bone or a bloody scar, these people would suffer on the inside. And then these were the people that I felt I could help the most. Now, my grandmother was very close to me. She had cancer, and she had actually breast cancer. And I am born in Sri Lanka, which is a little island, south of India, far away. But, when she had cancer, and they realized that they couldn't heal it, they couldn't treat her. So essentially, the medical field couldn't solve this problem. They sent her home with medicines, and we would give her medicines every 3 to 4 hours that did absolutely nothing for pain. And I found out that these are actually just Tylenol or acetaminophen, which we use today for headaches and just simple aches and pains. Now, the type of cancer that she had was breast cancer that spread or metastasized to her bones. And I know now that it's one of the most painful things that exist. And today we treat this pain very differently. We use medicine that's delivered in the spinal fluid. We use a variety of different opiate and non-opiate medicines. And so as I look back, I think pain is one of those things that the medical field can easily ignore and not focus on because it cannot be healed. And that kind of brought me into pain management, and has been something that I truly enjoy. I enjoy every single day. I enjoy seeing patients do well. I love hearing the success stories. I love their little letters and, pictures they send me from doing things that they could never do before. And I typically work now a lot with spinal pain. And simple injections like epidural injections or radio frequency rhizotomies can be life-altering. And these type of treatments can really make an individual be able to cherish and experience life in a way they never could. And that definitely has been something exciting to me. My name is Haz Qasim. My friends call me Haz. And I was trained throughout the country. I went to medical school, osteopathic school in Florida, where I learned a lot of manual medicine, which I use to this day in diagnosing patients. I then went to the University of Minnesota, where I trained in what's known as physical medicine and rehabilitation. So physical medicine and rehabilitation is a specialty where we work with individuals having a lot of life-altering events, like such as stroke, spinal cord injury, brain injury. And these individuals are then cared for, and I got a great experience of the musculoskeletal aspect of pain and the emotional consequence of pain. So when I finished training in the University of Minnesota, I really didn't have much interest in pain management. But a physician there, who actually is one of my mentors now, brought me into this world where we could actually use a comprehensive plan and help guide people to feel better. Now, some individuals feel complete relief in a few months just by simple things like some medicines or some injections. But then there are those that need a longer regimen of treatment. And it's possible to help all these people with a good treatment algorithm. I then got involved in research as one of my passions in Minnesota. I worked on a few different studies, and we actually were able to work on many new innovations for pain management. And most of that research is now slowly coming out into a field of medicine, and it is going to be very beneficial to help people. So my mentor introduced me into the field of pain management, where we would implement a comprehensive care plan, medications, therapy, behavior modification, interventions, and even alternative treatments, and help people reach the fullest potential of their lives by alleviating pain, reducing suffering, and improving comfort. So that really is my motivation and my drive with treating people. And again, I really love the day-to-day interactions, the little stories you hear from all patients. And, every day is a different and fun day. So I wanted to move closer to my parents, move closer to home. My parents live in California, and I was pretty happily settled in Minneapolis. And then when I moved closer, I was looking around, and a couple of my friends live in this area. So that brought me closer to these guys, and loved it ever since. I like a lot of fitness type stuff. I run frequently, and recently I got into jiu-jitsu, which, it's kind of a fun little exercise. There are a few different clubs here in the Coachella Valley, and it's a very interesting way of getting a good exercise, good workout, but also, jiu-jitsu is it's a form of martial arts where you're essentially trying to outthink your opponent. It's not really about strength, but it's a lot about technique and how you implement these strategies. And so for me, that's a very great form of stress relief. And after a few hours of that, you get a great workout, and it's something that I truly enjoy. I also love to travel. It's one of my passions. I've top 3 list of places to visit. Cairo was my favorite. Love it. The history was unbelievable. Also, the second most favorite place that I visited was Istanbul. I got to see some of the most amazing relics from, the Ottoman time, the Greeks and the Romans, and that was just unbelievable. I still have a few more places on my list that I'd like to see, but traveling and history are definitely passions of mine that I think will be always a part of my life.